listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, join us as we jump in our time machine and travel back 20 years to document quite a few Medicare firsts, like the first AEP, the debut of Medicare Advantage, the launch of Medicare Part D, and so much more. Celebrating 20 years of Medicare AEPs and growth, looking back at 2005, written by Roxanne Anderson. 20 years, 2 full decades. That's how long Americans have been able to utilize what's known today as the Medicare Annual Enrollment Period, or AEP, as we call it. Did you know this opportunity to make coverage changes looks vastly different than when it first began? If you're like Cal and Craig Ritter, Ritter Insurance Marketing's founder and CEO, then you not only know this, but you've lived through and adapted to the adjustments. In our podcast intro, you've probably heard me say that the insurance industry is anything but static. But it's not just our industry. The scope is much broader. Technological advancements and societal shifts have not only driven changes in our market, but the way of the whole world. Silence your smartwatch and your phone and join us as we take a brief look at Medicare history, particularly where the market stood 20 years ago compared to where it stands now. Before diving into where the Medicare market was back then, let's set the stage. In 2005, internet was slowly speeding up. Okay, it was a little faster than that. Chad Hurley, Steve Chen, and Javed Karim had just given us YouTube. Who could predict how many hours we'd spend on that? Star Wars fans were excited but sad for Revenge of the Sith, what was thought to be the final installment of the series, and happens to still be thriving on Disney Plus today. Speaking of streaming, do you remember Netflix back in 2005? It was DVDs you received and returned via good old snail mail. You had to watch TV live or through your DVR if you had one. 2005 brought us long-running TV shows like The Office and Supernatural. American Idol was extremely popular on Tuesday evenings, and you were pretty happy if you were cheering on either Bo Bice or Carrie Underwood. One of them now has 8 Grammy Awards. Or maybe you were listening to Boulevard of Broken Dreams by Green Day on your iPod Shuffle. Or your kids were making their own music in a popular new video game. Guitar Hero, anyone? Sports fans, these next facts are for you. In 2005, the Chicago White Sox won the World Series, and the New England Patriots won Super Bowl 39, making it their 3rd title in 4 years. Roger Federer and Justin Hennon Harden won their U.S. Open tennis championships, and Michael Campbell won the U.S. Open for golf. All right, now that we've got some pop culture context, what was going on in our industry? 2005 was a momentous year for the Medicare program. On January 28, 2005, the Centers for Medicare and Medicaid Services, CMS, published a final rule that established and regulated the Medicare Advantage MA and Medicare Part D program. Later that year, the very first Medicare AEP started on November 15, 2005. It ran through May 15, 2006, officially making AEP history. 2005 also marked the last year that Medicare beneficiaries could change Medicare plans monthly, which had been permitted every prior year. If you're wondering the history of Medicare Advantage or how long have Medicare Advantage plans been around, here's a quick summary of the legislation that led to the Medicare program's establishment before we move on. 1965. The Social Security Amendments of 1965 created Medicare. 1972. The Social Security Amendments of 1972 first permitted Medicare to contract with HMOs. 1997. The Balanced Budget Act of 1997 created the Medicare Part C Medicare Plus Choice Program and Preferred Provider Organization, Private Fee-for-Services, and Medical Savings Account, or MSA, plans. 2003. The Medicare Modernization Act of 2003 established Medicare Part D, regional PPOs, and special needs plans, and renamed the Medicare Plus Choice Program to Medicare Advantage, also known as Part C. Did you know Mark McClellan was CMS Administrator in 2005 and George W. Bush was President of the United States? And fun fact, in 2011, CMS changed the Medicare AEP to span from October 15th through December 7th. And now back to Medicare Part D. In 2005, Medicare generally only covered drugs administered in a hospital or doctor's office, so Medicare Part A and B. It did not yet cover outpatient prescriptions, the drugs beneficiaries bought at pharmacies and self-administered. President George W. Bush's signing of the Medicare Modernization Act, or MMA, in 2003 established the voluntary program known as Medicare Part D for the 2006 plan year. Much like today's beneficiaries, this gave Medicare eligibles an option for outpatient drug coverage outside of Medicaid or group health insurance. The MMA also authorized regional PPOs and special needs plans, or SNPs as we refer to them. These plans were introduced to beneficiaries as options for the 2006 plan year. 2006 marked the introduction of 2 additional Medicare supplements. Med Supp plans K and L hit the scene thanks to the MMA. Their out-of-pocket, or OOP, limits were $4,000 and $2,000 respectively, nearly 81% lower than their out-of-pocket limits today. With the introduction of the new Med Supp plans and Medicare Part D, we also saw the fall of Med Supp's H, I, and J. Those 3 plans all offered prescription drug coverage, but the benefits were dissolved for new Medicare eligibles upon the start of Medicare Part D back in 2006. Today, Med Supp plans C, E, F, H, I, and J are all no longer available for those newly eligible for Medicare. Medicare cost history, then and now. We don't think it's any surprise that Medicare cost less in 2005 than it costs today. Let's take a look at what Medicare premiums and deductibles were 20 years ago compared to what they are today. 2 decades ago, the monthly Part A premium for those who had 30 to 39 quarters of Medicare-covered employment was $206 compared to $285 in 2025. For those with fewer than 30 quarters of Medicare-covered employment, they paid $375 back in 2005, compared to $518 in 2025. Fun fact, beneficiaries qualified for premium-free or reduced premium Part A based on the same guidelines used today. As for Part A cost-sharing fees, including the deductible and coinsurances, those costs are now 84% higher. To view a table comparing those costs, be sure to read the text version of this episode with the link in the notes. We'll move on to Medicare Part B next, and brace yourself. The Part B deductible and premium are both over 130% more expensive nowadays. In 2005, the Part B deductible was $110. Today, it's $257. The Part B premium was $78.20. Today, the Part B premium is $185. And another fun fact, currently, beneficiaries with higher incomes have to pay more for their doctor insurance, but everyone paid the same Part B premium in 2005. Part B income-related monthly adjustment amounts, or IRMA, as we refer to them, were not published in the Federal Register until October 27, 2006. IRMA premiums officially started in 2007. And the Part B immunosuppressive drug, or Part B ID benefit, only began in 2023. What about Medicare Part D costs in 2006 versus 2025? You likely know that Part D prices have increased, especially between 2024 and 2025 with the implementation of the Inflation Reduction Act of 2022 changes. Did you know that the Part D deductible set by CMS has increased by $340 or 136% since 2006? And when it comes to Part D plan premiums, those dollar amounts were set by insurers back then and still are. Back then, beneficiaries paid less than $24 for their Part D plan premium. Today, the average Part D premium is roughly $47, representing an almost 94% increase in cost for Part D plan premiums than when Part D coverage first began. Now that we've looked at the history of cost in Medicare, let's turn to another area where we've seen growth: Medicare enrollment and plan availability. Back in 2005 and even 2006, that was still several years before the first of the baby boomers aged into the Medicare program, and more than several before an international health pandemic. We've definitely seen growth and change in the number of Medicare plans and enrollees over the years. Here are some stats to prove it. In 2005, approximately 42.1 million people were enrolled in Medicare, with 35.6 million of those qualifying from aging in. Currently, 62.8 million people have Medicare Parts A and B, and around 10,000 people become eligible for Medicare due to their age each day. 54% of Medicare beneficiaries currently have a Medicare Advantage plan. The number of Medicare beneficiaries enrolled in Medicare Advantage plans has grown 41% since 2005, when only 13% of beneficiaries were enrolled in these plans. And breaking down the MA market a little bit further, let's compare HMOs versus PPOs. Overall, market share is now more balanced between these two types of plans, but exact plan availability still varies by location. Back in 2005, the Henry J. Kaiser Family Foundation reported Medicare Advantage HMO plans represented a whopping 95% of the market. PPOs represented 1% of the market, with PPO demonstration plans representing 2%. In their 2025 Medicare Advantage Spotlight, KFF, same organization, just an updated name, reported HMOs currently represent 56% of all Medicare Advantage plans on the market. Local PPOs account for 43% of the market, and regional PPOs account for 1%. Looking back at the numbers, there were 179 total Medicare Advantage plans offered in 2005. The average Medicare beneficiary could choose from 42 total Medicare Advantage plans in 2025, including 2,066 HMO plans, 1,588 local PPO plans, and 43 regional PPO plans. And as far as those $0 premium plans, when Part D coverage debuted in 2006, nearly 70% of beneficiaries had access to $0 premium Medicare Advantage Part D, or MAPD, plans. In 2025, 99% of Medicare beneficiaries have access to at least one $0 premium MAPD. Special needs plans also debuted for the 2006 coverage year. Back in that first year, there were approximately 275 SNPs, 226 dual-eligible special needs plans, and 13 chronic condition SNPs. For coverage year 2025, there were 1,445 SNPs offered nationwide, including 909 D-SNPs and 376 C-SNPs. Special needs plan enrollment has come a long way. There are over 400% more plans for dual eligibles to choose from. Enrollment in both D-SNP and C-SNP plans are more than 5 times higher today than they were in 2010. Now, let's take a look at Part D changes and challenges. The Part D market started with 1,429 standalone prescription drug plans, or PDPs as we call them. Plans were available from 48 sponsors in 2006. In 2025, KFF reports just 464 PDPs available from a total of 7 sponsors. This is the lowest number of Part D sponsors and PDPs ever available. As prescription drug changes in the IRA started taking effect in 2025, including the $2,000 out-of-pocket limit, more pressure has been put on standalone Part D sponsors and PDP premiums. And one final category we'd like to highlight. Think of all the technological advancements we've made together. Smartwatches did not exist in 2005. Neither did a lot of the technology and programs we use in the Medicare industry today. The rise of quote engines. In 2005, many agents were left to their own devices and calculations for client plan quotes. If you were on the cutting edge, you might have built an Excel document with formulas you could turn to, but you didn't have the quick-click quote engines and real-time data feeds that exist today. Fast forward to 2025. There are numerous agent and consumer-facing quote engines available online, whether you're on your desktop, laptop, smartphone, or tablet. Ritter Insurance Marketing offers free access to state-of-the-art agent and consumer-facing Medicare quote tools. Fax getting the axe. Fax isn't dead yet, but we wouldn't say it's the go-to submission method for Medicare applications anymore. Nowadays, agents can scan, upload, and submit a document digitally. Top agents help their clients complete Medicare insurance applications 100% online. We can save paper, trees, ink, gas, wear and tear on our vehicles, and precious time and effort while reducing the risk of Medicare application mistakes and delays. In the days of disruption, streamlining sales can go a long way toward helping more clients who need assistance. Rolodexes turning into CRMs. Were you using a Rolodex and paper files back in 2005? Hopefully you've upgraded to a Customer Relationship Manager, or CRM, since then. Digital files do have their perks. Not only are the files backed up to an online server, making them much harder to lose, they're also easy to search and update anywhere you go. Some CRMs, like Integrity's, allow you to ask your clients to update their own records. Even better, you can also run quotes based on the information in a client's profile or automate marketing outreach. And this is just scratching the surface of the changes that have occurred over the past 2 decades. We hope you enjoyed looking back and reflecting on where things were in the Medicare industry 20 years ago compared to where they're at today. Just think how far we've come. Oh, and you can turn your smartwatch volume back up now. Here at Ritter Insurance Marketing, the FMO that powers this podcast, we are so thankful for the agents, partners, and staff we have worked with over the course of 20 AEPs. Ritter was founded in 2005, and today we're still here, stronger than ever. Whether you've been with us for a few AEPs or you're just starting out, we look forward to growing together. If you haven't already, register with our site, ritterim.com, and check out the resources we mentioned in this episode. We mentioned a lot of sales tech that is completely free for agents to use, and we also offer training events and learning resources in addition to this podcast. We have links to all of that information in our episode notes, so be sure to take a look. Thanks so much for listening to this installment of the Agent Survival Guide podcast. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Roxanne Anderson, script proofing by Emily Markovic, recording and production by me, Sarah Ruppel, podcast design by Urban Rivera, artwork by Zach Rutherford. Rate and review our show on Apple or Spotify.